My name is Jim Magera, and I'm a urologist. I'm board certified through the American Board of Urology. And I'm not subspecialized, but I trained at the Mayo Clinic, so I had a lot of, I'd say, advanced training in robotics, and most of that is for cancer therapy. I love Missourians in general. I think that being from Montana, that patients from Missouri have kind of a very similar kind of down-to-earth sort of approach to their health care. I think people are very well grounded here. I think the rural background of a lot of Missourians here in my area is really appealing to me because my wife is a farmer's daughter and I lived in a town of 9,000, 40 miles from the Canadian border. So I feel like the patients kind of in that aspect, I really have a lot of commonality with and a common ground that it's fun. I think it's fun for both the patient and for me to kind of get to know each other and what our backgrounds are. A goal would be to feel better, basically, from a urologic standpoint. And when the urinary system isn't functioning correctly, it affects every facet of life. You're out having fun with your family, you're interrupted. You're trying to sleep, you're interrupted. You're at the movie or the Chiefs game or the Royals game, you're interrupted. So we're just trying mostly to try to understand those goals, but the most basic goal for most patients is to not even worry about their urinary system. We try to start at the very simplest step, and that might be some things the patient can do. Drink more water, take less salt in. We don't start talking about surgery right away. We think about basics first, and then if the intensity or the severity of a problem urologically would seem to demand surgery immediately, we start talking about options, but then we talk about the least invasive surgical options first. And then we also, progress and talk through the various options. So I think doing the least to get the most benefit to the patient is what everybody would always want, and that's kind of what I want to offer. It's a team approach to the patient, and it will be a team approach for my entire career. And I love being a specialist and understanding what I do well, and also I strive to understand what other people do well and to have a close integrated approach. And that's really the Mayo Clinic way, and that's where I was trained. Robotic surgery in urology is the primary mode of surgical management of almost any condition. And so when a patient is referred to me and they need an abdominal procedure, my first thought, not my only thought, but my first thought, my second thought, my third thought is, what is the robotic approach to this? Because through small keyhole type incisions, you can do almost any procedure in urology. If somebody asked me if bigger is better in medicine, I'd say it depends. I think that Liberty Hospital is unique in the fact that it has a complete community focus, and I would say that supporting Liberty Hospital supports the community.